there we go. Yeah, so we had a New Year's Eve party and kind of interesting. We ordered tacos, we catered it, and we probably had like 60 people there, so pretty big party. And we ordered like one of my buddies owns a pizza place. So he brought 10 pizzas right at the beginning of the party and we're like, "Okay, well we'll eat those later. Let's put them in the oven for now and then we'll heat them up later on in the night after like maybe like 10:30, 11." And we ended up deciding to cook those pizzas, so we turned the oven up to like 350, not thinking, remembering that there's like 10 cardboard boxes in our oven, and it was literally like flames coming out the top. And I carried this big stack of like five pizzas where the two boxes are on fire and just threw them into my sink and like hosed them all off. We were able to, we were able to salvage some of the pizza, but it was an interesting thing. And it made me really start thinking about where are my fire extinguishers and do I have a fire blanket? And should know where those things are because man, wasn't expecting that, and that happened really fast. And thankfully, it just my house still stinks a little bit, so it's all good. But hey, thanks everybody. Happy New Year! Thank you so much for being here for this meeting. These are the things I want to share with you. And what's interesting is that that's just not like, I mean, this is actually what I have always done in my practice. I've done these yearly. And then some of these exercises, one in particular, the seven systems exercise, I used to do this quarterly and I still do. It's like I feel like it is what constantly keeps the needle moving forward. And I think you'll find that this is a little bit different from most goal setting workshops in the extent that, you know, like I'm not going to get into like, how are you in your health? How are you in your relationships? How are you with your spirituality? I mean, you can do that anywhere. I mean, this is Dental Practice Heroes. We're talking about dentistry. We're talking about dental practice ownership. We're talking about things that are going to move the needle as far as us professionally, right? And I don't only want to focus on revenue goals. I'm actually going to kind of steer you away from revenue goals for the most part. I think that's different as well. But what I want to focus on is things that make our life better because these are the things that I have found useful. These are the tools that I've always used. So I'm going to share them with you today. Cool. All right. So for those who stay to the end, I do have this Dental Profit Playbook. I'm going to give the link to this at the end. It's an awesome document. 30 ways of just making more profit, how to make more money and work less. That's what people always want to typically do, right? That's what we want. We want to work less. We want to make more money. We want to have more peace in our life. All right. So let's get started. All right. So why do most goals fail? It's one of those things is that I think that most goals fail because we don't really have goals to begin with. They're kind of just ideas. They're kind of just like things we think about, like, oh, that would be nice. Or, this year I think I'm gonna really try to start doing a little bit more of this. It's not very concrete. It's not very action oriented. But for me, I have always been such a big fan of pen and paper, and if you listen to the podcast, you hear me talk about this pen and paper. There's something magical about writing down your goals and actually giving it the time that it deserves. And I'm just like you guys. I'm busy. I get busy parts of my life where I know I should be doing more planning, more just like introspective work, more stuff like we're going to do today. And you just don't get to it. But then you give it the time it deserves and you start reaping the rewards of it. So most people don't even write their goals down. So just by doing this and showing up today, you're going to be way ahead the rest of the people that you know and way ahead of your dental peers. I mean, for the fact that you are even here, that you're a listener of the podcast, or you got onto my email list so that you could get onto this. I mean, that says a lot about you and what you treat dentistry like. I think if you go on Facebook, you're going to find a lot of people that disagree with you on how awesome our profession is. I think it's great. I think the potential is awesome, but I think you got to do things like this if you want to reach that potential. So, like I said, writing down goals, there's all these stats, and I don't have to go through them because you guys have heard them before, but writing down our goals makes it more likely that we're going to achieve them. It engages multiple parts of your brain. You got to write them down. But, the real reason that I think that they work is because it really slows our thinking down enough to reveal what is the truth. What do we need to really focus on? What is important right now? And when we write it, we create clarity. And then it's that clarity that creates the focus. And then when we're focused, now we can act on it. So that's what we want to do by writing them down. Now, if you look in the chat, I did post all three of these exercises we are going to do. If you want to print them out and do this with me, I guess ideally I should have got this to you before we started the webinar. But nonetheless, this is recorded. You will receive a recording and you will see, you will be able to do these things on your own, because some of them, we're going to go through pretty quick, but some of them, you could use a little bit more reflection time, right? But you know what? We struggle. What do we typically do? What are dentists typically doing? We're reacting, right? We're just reacting to every day. We're busy. Hey, how you doing, man? Man, busy. I'm just so busy. Everybody's busy. We're busy just handling the things that are happening in our practice. I mean, I can tell you because I've been coaching dentists for 6 years. Almost every dentist I talk to, just a common thing I hear is, man, I don't know if I'm really ready to work on my practice. I don't really know if I'm ready for coaching. It's just not a good time right now. There's just a lot going on at the practice. We're just really busy. We got one person that left. We're short-staffed. There's always things. You're always going to be busy. But what I want you to understand is that when we put in this extra time, this is an investment in how busy we are. This makes an investment that we can have more time in the future. So this thinking time is important. And I don't want you to confuse busyness with progress. Just because you're busy doesn't mean you're doing awesome. I mean, you could be making a good living. You could be very successful, could have great relationships in your life, but that doesn't mean you have to be busy. And that's like one of the things that I've realized over the past, man, how long has it been now? 14 years I've owned my practice, is that you don't have to be busy. It's not about how hard you can grind. It's not about putting in so many hours, working 60, 70 hours a week. It's about creating leverage in your life. It's about creating leverage to have people perform in a certain way that's efficient and effective without your guidance. And that's what we'll talk about today. That's what I'm going to share, what we do with all of our coaching clients towards the end of this call. I'm going to share what is the process we take people through coaching, because that's what the framework I want you to start thinking of taking yourself through, because you're trying to create a practice, hopefully, that's like a Dental Practice Heroes practice. So we also struggle. We set goals. We don't diagnose the problems correctly. We're looking in the wrong areas. We're not focusing on we're looking at a symptom instead, we're not focusing on the disease. So things like that. We're going to be different. It's going to be quick. We're not doing vision boards. I don't love vision boards. My partner, Henry Ernst, loves vision boards. He does a vision board exercise with his team once a year. I don't know. It just feels foofy to me. I just don't love the vision board. But man, I do not doubt if you make that vision board, I think you manifest that energy. You're getting clear on the things you want. I'm not talking crap about vision boards. They are just not for me. No vague intentions today. We're going to create some action steps. We're going to decide what are we going to do in the future this year that's going to make a difference. And I don't want to grow the practice goals. And what I mean by that is well, man, we did 1.2 last year. I'd really like to grow by 10% this year. Why? Why 10? What do you want? Will you hit 1.5 because it's the next logical big number? If you're hitting 1.5, 1.6, you're like, we got to hit 2 this year. It makes no sense. And the fact of the matter is I've had the grow the practice goals, and I've had the $1 million practice, and I've had the $6 million practice. And as far as I'm concerned, that revenue goal had nothing to do with the quality of my life. I mean, yes, did I make more money at the $6 million practice? Of course I did. But it wasn't the revenue in of itself. It was the other things. So I want you to realize that most progress is not in that growth, not in the grow of the practice. It's doing the things that are going to create that practice freedom for you. And what that practice freedom is I'm going to show you in just a second. But you got to have freedom to do the things that we want. So what is a Dental Practice Heroes DPH practice? This is the practice that runs without you. This is what I think you should be trying to strive for. This is what, in the 14 years I've owned a practice, has made a difference in my life. It has made a difference in the way I feel. It's made a difference in the relationships of people close to me. It's made a difference in my fulfillment. Revenue is great. Revenue was always great. I mean, at a certain point, man, we were doing maybe $2 million a year at my office. I mean, I was making more money than I could spend. Like 6 million wasn't all that different from a revenue standpoint. And we see that in the studies. I think the last one, I mean, this might be a little old because I think it's a 15-year-old study, but it said something like after, 80,000 dollars a year, you don't really get much happier. It's once you take care of your basic needs, it's just more money. So it's not about the revenue. It's about the practice running without you. It will withstand you not being there, and it will continue to run, and you don't have to constantly check on it. I want you to be able to practice as much as you want. Now, some people say, well, I love dentistry, so Dental Practice Heroes is not for me. Like they really preach, like they'll say I preach like don't practice anymore, go non-clinical. I'm not saying that at all. I'm saying practice as much as you want. I started off 4 days. Right out of school, I practiced 5 days a week. I just never was able to do that. I just always thought it was too much. But I was 4 days for a very long time. Then it was 3 days, then it was 2 days, and then it was 1 day, and then it's a half day. Right now, currently, I am doing 1/2 day every other week. So that is how much I'm practicing. But that's what I want to do right now. I'm only doing band and bracket ortho because that's what I want to do. Only the procedures you like. I'm only doing band and bracket ortho. The first procedure I got rid of was just direct composites. Said I'm not doing them anymore. That's going to go to my associates. I just don't do it. And my team would tell patients, I know you want to see Dr. Edgerton. You know what? He's focusing on specialist procedures. He doesn't do that procedure anymore. Now, occasionally, if somebody had like a bunch of other stuff to do, I would still do a filling. It wasn't like I was completely free of them, but I was only doing the procedures I liked. I eventually cut it down to just doing implants, veneers, and ortho, and eventually just veneers and ortho, and now it's just ortho. And I'm doing band and bracket. I like the teenagers. They just like, they're cool. They're chill. It's like, hey, man, what's up? They're like, nothing. And that's it. Like, I don't have to like put on this big front of like just enthusiasm. And you know how it is, like with new patients and stuff. I mean, I'm a very social person, but doing that all day long always very much exhausted me. So DPH practice, only the procedures you like. And I want to be clear that this is ethical things we're not doing, or this is ethical things that we are doing. We are not cutting corners. We are not screwing over our team. We are not screwing over our patients. Everybody wins in a practice that is designed the way that Dental Practice Heroes shows you how to do it. We have a happy team. They take care of your patients. You have happy patients. Everything is ethical. Everything is good. Everybody wins. There are no corners being cut. So let's get started. Let's do the first exercise here. So this is the first one. It's the practice frustration and clarity exercise. I love this one because it really focuses on improving what frustrates us. I think we got to really sit back and ask ourselves, what am I frustrated with at my practice right now? What frustrates me? Because there's so much information that comes from that question. And this is one of the things you've heard me talk about one-on-ones, talking with your team, discussing with them, saying, hey, like, what frustrates you? That's what the point of the one-on-one is. I mean, it's so that we can show appreciation to the team member, so we can build relationship. But ultimately, I want to ask that team member, what is frustrating you at the practice? Because that frustration is a single signal to me what I can improve on. So what is the frustration? So we're going to do this. This is the first question here. So what specific tasks, situations, or responsibilities in your practice frustrate you the most? So I want you to think about what kind of things just piss you off that you have to do, that you have to deal with, because these are the things that are going to make you feel a lot better about your life. I was working with a life coach at one time. We went through all the things I did during a week, and then we wrote down next to him, how many of these bring me joy, how many of them I neutral on, and how many do I just absolutely hate? And I want to tell you, at that point in my life, I hated like 80% of the things I was doing. So when we listed it out, we decided, what are the things that frustrate me, and what are the things I need to get rid of, and what can I do about it? Because a lot of times these frustrations, the second column here says, is this an unavoidable part of being a practice owner? So I think we're so guilty of saying, yeah, that part frustrates me, but that's what it is being a practice owner. And I think there's a lot about being a practice owner that really, at face value, seems like, man, I can't delegate that. I'm the only person that can do that. I have to do that for the rest of my life. I don't think so. I mean, one thing that used to frustrate me was just seeing new patients. I didn't want to put on that happy face all day long. So I said, you know what? I'm not going to see new patients anymore. Well, who's going to do that? Yes, you have to have an associate. I mean, you still have to see new patients at your practice. but you can get away to somebody else. One of my favorite things I did at my practice was I stopped seeing hygiene. I just saw my patients that wanted to see me. I just saw the procedures I wanted to see. And I didn't have to get up and check hygiene because that was something that frustrated me. I mean, it was, I know these are first world problems, but I didn't want to be bothered. I wanted to do my dentistry. So we're going to take 2 minutes really quick and let's think about what's frustrating you. Ask yourself if it's an unavoidable part of being a practice and can it be delegated, systematized, or bounded better? And if so, think about how. All right, let's take a little break. Let's just go throwing the timer on. We're going to go 2 minutes here and we're going to get rocking. Let's see. Where did my timer go? There it is. Boom, boom, boom. Go. All right, so take 2 minutes and think about the things. What's frustrating you? What pisses you off at your practice? Okay, close enough. All right, that's a long 2 minutes. All right, cool. All right, so what pissed you off? You thought about these things. Now we're gonna come back to these things, so don't worry about this thing yet. All right, let's keep going. All right, bringing up my slides again. Here we go. All right, cool. All right, so next part, section 2. This is very similar, but this is different. This is not so much what frustrates you, but I want you to think at your practice level. These are things they might not necessarily like frustrate you, but you know they are recurring issues that continue to show up at your practice. Every week you deal with something like this. You know it's an issue, but you're not doing anything about it. Or maybe it's just like, well, I mean, things are going pretty good, but you know, that one thing happens. Well, why does it keep happening? So, what are some like 5 or 10 recurring issues or problems that keep showing up at your practice? And we're just I'm gonna give you a minute for that one because I think 2 minutes that was a long minute for me. I have like ADD. It's hard for me to sit that long. All right, 1 minute. What are 5 or 10 recurring issues or problems that keep showing up at your practice? Let's write them down. All right, cool. So now you got those things. All right, let's move on to the next part. So, what I want you to do is I want you to look at those lists of things you did, and I want you to pick the top 3 of the frustrations that would result in each of these 3 categories. So, which ones would result if you fix them? If you fix them, because sometimes we're always looking at profitability, we're always looking at money. If you fix that, which one of these would result in the biggest decrease in stress for you? Okay, that's the first one. Second one is which one of these would give you back the most time? Maybe fixing something that frustrates you that you spend a lot of time dealing with. And then the other one, profitability. Now, these are the ones we tend to focus on. I want to steer you away from that profitability because I think it's these things, the stress and the time, those are the things that are going to feel different. Profitability, it's fun to brag about, I guess. It's like one of those things. But at a certain point, we want to have a better life. We want to have feel better about our practices. Feeling going through burnout, frustrating, dealing with those things. So stress, which one is going to relieve the most stress? Which one is going to give you the most time? Which one is going to be the most profitable, give you the most profit? And we're just going to wait a few seconds here. All right. Next part. So this is going to be the diagnosis part. We decided which ones are going to relieve the most stress, the ones that are going to give us the most time, and which ones are going to result in the best boost in profitability. I love doing this exercise of the 5 whys. And because I think this is what I said, like sometimes we don't properly diagnose what's going on in our practice. We don't properly diagnose what we should be fixing, what we should be focusing on. So this example here is that I don't have time to work on the business. I would say that is 95% of the coaching clients I take on do say they do not have time to work on the business, or they have time, but when it comes time to do it, they don't get started and they just don't feel like doing it because they don't have the energy to do so because typically seeing patients. So I never have time to work on the business. Well, why? Well, because I'm always the one that's putting out the fires and reacting to the things. Okay. Well, why is that? Well, because no one else in the practice can handle those things except for me. But why is that? Well, they can't handle it because my team is untrained. Why is my team untrained? Because I haven't trained them and I haven't provided them with the proper training. That's why they're untrained. Well, why haven't I provided them with the training? Because I sure as shit ain't made it a priority in my life. So then we look at that and we say, okay, so what is the goal here? The goal is that I need to make training a priority in my life so that other people can put out these fires so that I don't have to. So you take each of those things, those top 3 issues, and you're going to go through this and you're going to do this. And it's just to save the time, like, I don't want to sit here and wait for you to do it. So, this is something that you'll do on your own because I want you to give this the time it deserves to think about it. Because the fact of the matter is doing this exercise and asking yourself why is going to show you what your action step is related to these issues that are going to help you with stress, time, and profitability. So you'll go through each of those issues and you'll ask yourself why. And every single why you get, it doesn't always have to be that last, the 5th why, but every single why does give you some sort of clues into what kind of action you should be focusing on and taking. Now, so you can see why these are better goals. These are better things to focus on. These are better things to prioritize versus, well, I did 1.5, I'm going to do 2 million next year. I'm thinking I want to spend more time on the business. That's lofty. What is that going to take you to spend more time on the business? Well, it's going to take you prioritizing training your team and delegating things, right? Okay, cool. So I think that's pretty good. We're wrapping up that one. Let's move on to our next one. Now, if you've got any questions, anything like that, just go ahead and throw it in the chat. I will get to it, I promise. So, and then I will do Q&A for just anything at the end of this as well. All right, let's go on to the second exercise here. So we are doing the 7 systems exercise. This is from my first book, Dental Practice Hero. And I love looking at my practice in this regard because it lets us zoom out and look at through the systems in our practice. Often when we're doing goal setting, we're so focused on the recurring themes, the things that we want to work on. It's revenue, it's revenue, it's revenue. And we miss a lot of opportunities to make our practices more efficient in all the other areas that, have just basically a lot of inefficiency in a lot of practices. And almost every practice I work with, they're very inefficient in all these areas. So when you look at this diagram, we're focusing on how does a patient move through the practice? Well, They come through the referrals or the marketing channel, and then they need to pass through our phone skills. How do we answer the phone? We have to convert them into a new patient. So once we do that, then they become new patients. They show up in our practice and they experience our patient experience systems, the way that we do things, the way that we make them feel, the nice things we do, all these little touch points that this consistency that we built into our practice so that every patient gets a consistently good experience. And then they go and we present our treatment to them. So that's the financing part, probably better named financial presentation. What can we improve in the financial presentation? So like our team is presenting finances, they're offering financial options, they're looking for objections, they're being the advocate for the patient, trying to get them to move over that finish line and say yes. And eventually they say yes, and that becomes accepted treatment. Then after the accepted treatment, we've got to schedule them. And oh man, is that a shit show in a lot of offices. That is the one thing we control every day, and we like write our death sentence every night when we look at our schedule. We go, oh my gosh, this day is gonna suck. And we do it every day, and we keep doing it. We never fix the scheduling problems. We should not run behind. Now, do we run behind? Of course we do sometimes, but if it is consistent, man, change the scheduling. I would say this is one of the most powerful things we do with our coaching clients is scheduling to production, scheduling based on DPH block scheduling. So moving you to a goal-based scheduling. Then it's the clinical skills. How do we deliver the stuff? How quickly can we deliver it? And we're not cutting corners. Remember, we're just doing it more efficient, more fast, utilizing our team. That turns into production. We've got to collect on that money, and then we got to reactivate them. So we got to keep them through the cycle, throw them back in hygiene, schedule them another visit, keep them in our practice so that we can continue to grow and we can continue to expand ourselves, expand our practice, as well as free ourselves up for more time and stuff. So we're going to go through the 7 systems exercise. So what we're looking at is each of these 7 systems. And it doesn't necessarily mean that the system's broken. The system doesn't have to be broken. But for every single system, what I want you to think about is what's not working so well in that area. So the first one we're going to do is phone skills. What's not working so well in that area? And I think 90% of the people will probably say, I don't really know. I don't listen to my phone calls. I don't check my answer rate. I don't check my new patient conversion. So if that's you, then what's not working well in this area is that I'm completely flying blind here. I have no idea what's going on the phones. So what action could you take to improve this? Now, this is the exercise that I mentioned. I'm doing this every quarter because I'm going to say every quarter, I'm going to have a big thing that I'm doing. It doesn't always have to be huge, but I'm talking about there is one big goal every quarter for each of these 7 systems. So phone skills, what's not working so well? What action could you take to improve it? All right, patient experience. What's not working so well in that area? Some people might be inconsistent. You know, we have inconsistency between providers. We have no patient experience systems. We've never created our play. We've never written our script. We never decided what x-rays people get, what diagnostics they get. What is the standard? We've never standardized any of that. So that might be something you want to work on. Maybe standardizing what is the new patient experience? What do we do? I will tell you, you know, we take photos on everybody. We take 20 intraoral photos. What if they have nothing? We take 20 intraoral photos. This was, you know, you've heard me talk on the podcast. My wife is a hygienist. That was one of our early sticking issues when we worked together. We take 20 intraoral photos, but she didn't want to take 20 intraoral photos because she is my wife, and sometimes the patients don't need any treatment. And I said, no, we take 20 intraoral photos. We all consistently do that. That is part of our patient experience. It's part of our experience to show the patient what we see inside their mouth. So patient experience, what's not working so well? What action could you take? Financing and presenting treatment has, you know, this is one of the things that we do in Dental Practice Heroes is people never train front desk on how to present treatment in a way that's persuasive and that helps the patient say yes. So like they're going in it with like, well, I show them the finances. I ask them if they want to schedule and they say, no, I'll get back to you. I'll let you know. And I say, thanks and have a nice day. And I think I did a really nice job. No, I would say that's the bare minimum. Yeah, that's expected, but that is the bare minimum. So what's not working so well in this area? Could you close more treatment if your team was better trained? Could you close more treatment if perhaps your team understood how to use all the outside third-party financing? What if they started offering it to everybody? So like, what are some things? What's not working so well in this area? And if you've got the statistics on case acceptance, you'll have some baseline metric of, where you can go, what you can do here. But this is something that people never focus on, and it's a huge blind spot. So what's not working so well? And this might be, again, I don't know. I don't know what's not working so well. So your action item might be ask your team what's not working so well. What can we improve upon? Scheduling. What's not working so well in this area? I know you have an answer for this one. Everybody knows what's not working well in the schedule. I would say before I got really clear on my scheduling principles, what was not working well in my schedule was that we had a ton of tiny little filling appointments over and over again, just a ton of appointments, short things, quick, easy, but mentally draining. We had too many of those. So one of the things that we did in our scheduling is we limited how many of those little appointments we'll see each day. I will not see a full day of that. I will see 1 or 2 of those every day. That's it. So we started limiting that. So what's not working so well in the scheduling area? And what is an action that you're willing to take to improve that? All right, clinical skills, delivery of care. So this could be, I work really well with one assistant, but I don't work very well with the other one. When we operate a root canal, it takes a really long time. Or when I like to utilize hygienist numbing more at my practice. I would like my assistants to have the room set up to the standard that I've created. I would like my assistants to do a bunch of things before I even get into the room. And they don't do that because I've never asked them and I've never standardized what we do before the doctor walks into the room. Or it might be like, I want to learn how to do molar endo. I need to take a course on surgical extractions, things like that. How can you improve on your clinical skills or the way that you deliver care? Things that we've standardized in our office, the recall exam. I mean, this takes 2-3 minutes. What do we do? What do we go through with the patients? What are the questions we ask? How do we do our exam? And I'll do my exam and I'll reach over and the hygienist will hand me a Velscope. I do an oral cancer screening. She hands me a piece of gauze to grab the tongue, hands me a mirror. It's like it's rehearsed. We know how to get through this. Now, I'm not giving the impression that we're rushing through our day. We're not, but what we're not doing is we're not sitting there waiting. Okay, hand me the Velscope. Yep. All right, get the articulating paper out. Yep, we need it again. It's another restorative appointment. We're going to need that again. You know how it goes. All right, collections. What's not working so well in this area? You should be collecting 98% of your adjusted production. So if you're not, you need to find out why. And you need to run an AR report and see what's out there. You should not have more than 15%. And I think 15% is extremely generous in your plus 90. I mean, I think you should be doing way better than 15%. But your 90 plus, I mean, the only way to grow your 90 plus is nobody's looking at it. Nobody's looking at it. I guarantee it. If I see 90 plus in your AR, nobody's responsible for it. Nobody's looking at it. So what you might think about doing in this area is seeing where you're collecting, running an AR report. And in a lot of offices, the AR report's not very accurate because there's just so much garbage on there. So your thing might be, well, we're going to clean up those 90-day plus things. We're going to write those off. We're going to write off the balances. We're going to send some people to collections. And we're going to make sure that we don't ever allow that to happen again. It might be if you have a lot of patient balances. We're going to collect all those. But going forward, what we're going to do is we're going to pre-collect. And we're not going to start a procedure unless the patient portion is paid. If you're creating a lot of insurance balances or you're creating a lot of balances because of insurance misestimates, we're going to figure out why we keep doing that, why we can't do an accurate estimate. What clauses are we missing? Where is there an understanding of the insurance clauses? Things like that. All All right, reactivation. So this is not just like reactivating, like bringing patients back, but keeping patients in our system, reducing our attrition, making sure we keep people in the system so that our practice can reach capacity, because that's what allows us to grow. Getting to that capacity point. You get to that point, everyone says like, well, about 1,200 active patients per doctor. Yeah, I mean, that's pretty right, but I want to do things that are going to create that capacity point. I don't care how many patients it takes. I mean, it's going to take a lot less patients, a lot less active patients to get me to capacity if I'm seeing more new patients. So you can grow faster. So we're keeping people in the system so that we can reach our capacity point and we can move forward to the next level of practice freedom. So looking at each of those 7 areas of your practice and saying, what is working, what's not working so well? What can I improve on? Do this one quarterly. You will be amazed at how fast you move the needle when you start focusing in on each of these 7 areas. Because if you don't force yourself to go to each of these 7 areas, there will be 4, maybe 3 or 4, 5, those areas that will be neglected for your entire practice career. Financial skills, financial presentation, neglected for nearly every dentist. Okay, let's do the third exercise. Now, this one is going to take a little bit longer to do, so I'd rather you do this one. We won't do it together, but I will show you how to do it, and you can at least get it started. This is a very basic exercise, okay? This is something that seems so basic. Everyone goes, nah, I don't need to do that. I know I don't need to write this stuff down. Let me tell you something. I've been coaching dentists for 6 years. Every dental practice that I coach, if I can get the owner to do this exercise, it will change their life. Every single time. We've got somebody in our mastermind that did that. And he said, man, as soon as I wrote this down, I'm just like, I'm peeling through this stuff. I am delegating things left and right. So it is worth doing. So one of the most important things that we can do at our practice is we often say, I don't really have time to work on the practice. Whenever I do get time to work on the practice, I'm doing a bunch of admin stuff. So if you don't have time to work on your practice, these are the investments you need to make. So you need to write down everything that you're doing, write down how long it takes you to complete. I can tell you that sometimes things that take 5-10 minutes are really, you're like, well, it only takes me 5-10 minutes. No big deal. Those add up and those become mentally draining until you're doing the point where you write this out and you say, how much of this brings me joy? And you realize that 80% of your life sucks when you're at work. It happens. So write down how long it takes to complete. And I want you to think about, do you hate this? Do you love it? Or are you kind of neutral about it? You hate it? Do you love it? Or are you neutral? And I'll tell you what you're going to do with that. When you go through hate, neutral, love, anything neutral, just put that in the parking lot. Say, well, we're going to take care of that later. That's not a high priority now. Anything you love, those are the things that you say, you know what, I'll just keep doing it. I enjoy it. Chances are you're not going to love doing it forever. I used to love doing payroll. It was fun. Felt like I was a business owner. Sitting in there, entering hours, pressing enter to do all the direct deposits. It felt kind of cool. Eventually, it became a big pain in the ass. I used to do my own bookkeeping. I used to do it at the end of the month. And then it became I was doing it at the end of the year. So eventually you stop liking doing those things. So everything you hate now, those are the things you are going to delegate. You are going to figure out a way to delegate them. Now, when you write down all these things that you're doing, you will have a list to pick off of. Every week, you can pick 2 or 3. And I assure you, you can delegate all of your responsibilities to the point where the only thing you are doing is just being the vision creator, just being a supporter. You don't have any responsibilities at the practice. You can get your practice to that, I assure you. And I'm telling you, I said I'm at the practice 2 half days a month doing band and bracket ortho. And then I probably spend another 2 half days just there working with my team. So maybe a total like 10 hours clinical and maybe 6 hours a month just kind of working with my team, checking in with people. And the practice doesn't need me because all the responsibilities have been delegated to other people. So ideally we get to the point where you're not the one doing everything. And these are the things that will make you get this practice freedom that I talk about. So give it the time it needs, give it the time it deserves. This is the exercise that it seems basic. I know what I need to delegate. I don't need to write it down. I'm going to take care of these few things first. Writing it down, you will get there so much faster. I promise, I guarantee it. All right. So now what did we do today? We looked at our frustrations, right? So instead of like saying like what are the goals, we said what frustrates me because I want to fix those things. I want to be proactive about fixing the things that frustrate me and picking out the things that are going to result in the biggest decrease in stress, the biggest gain in time, investment in time, and make me the most money. What's going to increase my money in production? The thing is if you do that 7 systems exercise, every time you improve something in those 7 system areas, it will always translate to money. And you're still taking great care of your patients. You're still taking great care of your team. Your team loves being at your practice. You know, it runs well, it's consistent, and that money comes there. So I never thought I needed to focus on dollars. You don't need to focus on dollars. You need to focus on efficiencies. Let the dollars be the reflection that you are taking great care of people. All right. Then we went through the 5 whys exercise to diagnose and kind of illuminate where we need to focus, where our action needs to be. We went through the 7 systems thing. We strategized what we want to do in each of those. And then lastly, we did that doctor delegation list and we said, do we love it, hate it, or neutral? We're keeping the things we love. The neutral things we'll pause for later. The things we hate, we're going to get rid of those first. So how do we create a dental practice heroes practice that allows total owner freedom? So this is at DPH, we've been helping dental practices and coaching for 6 years now, 6+ years. And we want your doctor. We want you to we want a 7-figure year for you. Okay. I'm not talking about collections. I'm talking about you as the owner. I want you to make a lot of money. I want you to take 12+ weeks off every year. And I want you to enjoy a lifestyle that's just awesome. And I don't want you to feel bad about it because there's nothing to feel bad about. You are going to create an amazing practice that is going to do amazing things for your community and is going to be an amazing source of just accomplishment and just purpose for your team. Everyone's winning. We're not screwing anybody over. Everybody does better when we take good care of people. So what we do in Dental Practice Heroes, one of the first things I do with every office I work with is we've got to create ownership time. You need to have time to work on your practice. And most dental owners don't have it because they're seeing patients so much. So I'll tell you, if you're a coaching client, the first thing we're going to do is we're going to get you to 3 days clinical, and you're going to make more money on 3 days clinical than you ever did on 4 or 5. And I know that seems like, whoa, that seems a little pie in the sky. It's not. 100% of the time, it works. It always does. There's so much inefficiency. We create the schedule. We make sure that we've set it up in a way that you hit your goal and that we make sure that you do not lose any money and you go to 3 days. And when you go to 3 days, you open up that 4th day to work on the next steps. So we create that ownership time for you first. The next step is to train and empower leadership roles at your practice so that you aren't the person doing it all the time. So if you're a smaller practice, 8 people or less, that might be just 1 or 2 people other than you, but it needs to be someone other than you that is helping you run and manage the practice and grow it. Now, when you get that ownership time and that gives you time to train and empower the leaders at your practice, think about that 7 systems exercise we just did. So now instead of you having 7 things to improve upon, you've got a team of people that will take this and run. So see how like these investments, they snowball on each other. Get yourself to 3 days so you have time to work on ownership stuff. That ownership time creates time to create leads. Those leads are going to create full office systemization. In our coaching program, we call this Omni Practice. It's a 7-phase system. We take our practices through it. We do all the systems. We document everything. We make sure that everybody in the practice knows what they're doing. So it's training. We're creating the protocols. We're documenting things. We're making sure that we decide this is how we do things here, and there's a reason for it. Everything that we teach satisfies the 2 most important whys. Why is this the right thing to do for the patient? And why is this the right thing for the team? Because if it's not the right thing for the patient and it's not the right thing for the team, who's it the right thing for? Probably the owner. And that's really hard to get your team motivated behind that sort of stuff, right? I want my team to do things that are the right thing for the patient, the right thing for the team that works together. And those are the things. Profit's going to be a side effect of that. I don't need to focus on profit. We're going to develop the team, entire team skill-wise, because we're going to say, you know what are the standards that we require for every position? because when we require a standard, we can hold everyone to that standard. So then it's just a matter of training people up to that standard. So many offices gets just so like dependent on one or two employees that when we lose them, we're screwed. I had a coaching client of mine, had an office manager, went back to school or something like that. I can't remember why she left, but she was the only one who knew how to do so many things at the office. And it really took her 6 months to recover from that. It was really hard on her. So making sure that we're developing the bullpen, we're developing everybody in our practice equally, because not only will that prevent, it'll ensure, it'll take away that vulnerability of being dependent on one person, but you'll also have a full team full of all-stars, not just that one or two people. And then what we do is we systematically drive capacity. We make sure we can reach to that capacity point so that we can transition to the next phase of freedom, which as far as for me is, bringing on an associate. That's the first step, the first major transition that brings you major freedom. You bring on that associate and you do it in a way. I know people say, well, I had an associate, it didn't work out that well. Yeah, okay, I know you do it in a way. All right, let's see. Okay, 1 second. I go. All right, so you do it in a way that it makes sure that it is the right level of profitability so that you have like $650 per hour. We're gonna make sure every associate does that so it works. And that brings on associate 2. And that brings on associate 3. Now you're like, iPractice is not big enough for 3 associates. Okay, but there's solutions for that. I was running 2 associates out of a 5-op practice for a very long time. It can be done, but there's always eventually I expanded my practice. If you ever heard of 3 and free, 3 and free means when you get 3 high profit associates, and as far as I'm concerned, high profit or highly productive, $650 collectible per hour. That's what I want every associate to do. I've never had an associate do under it. So if you tell me that's just too high of a goal, I will tell you that you are wrong. That is not too high of a goal. I've done it with every one associates that's been in my practice. But when you get 3 people, you're free. And what I mean by free is that's when you can literally go non-clinical and most offices will still have a 7-figure take home. That's when you get that $1 million EBITDA. So this is what we want to get you to, because this gives you that freedom that if you want to practice less, you can. Now, you may not. You may like to practice a ton. That's cool. But it unlocks a completely different lifestyle for you. So that's what I want you to kind of be thinking of. All right. Stuff like that. All right. So I got the gift coming up in a second, and I'm running a little short on time, so I'm just going to breeze through this. But these are just some clients. You can go to the website, Dental Practice Heroes. Just check it out. This is Ryan Bradley. Went from 4 days a week, got himself down to 3. I believe he's down to 2 now, but he just completely exploded his practice. And it was when we worked on the systemization, when we got him the time to do the systemization, and we built the leads in his practice. It brought him peace. Same thing with Dr. Alex. She just wanted to spend more time. Like, she just felt like so many things were on her shoulder at the practice. We got her to 3 days. She brought on an associate. She did this out of a 6-op practice, and she is loving her life now because she has so much more time. And not only did she cut down days, all those things that relied on her no longer rely on her. She delegated them. Dr. Isaac, dude, this is one of my favorite coaching clients I've ever had. This guy's awesome. Literally, like, he had an acquisition, had a team that just didn't want the type of practice he wanted, and he was clear about what he wanted, and he went through and he found out what team members were coming with him, and nearly all of them left. And he felt really crappy about it, but he stuck true to what he wanted in his practice, and now he has a great culture, a great team behind him, and he's got, I want to say, 2 associates right now. And he's also, all these doctors, 3 days or less. I think Isaac's a 2-day doctor. He might be 3 still. I don't remember. I have to ask him. I still talk to Isaac. All right, but what makes DPH different? I mean, we're actual dentists, like the coaches, myself, Dr. Henry Ernst there on the left, and Dr. Steve Markowitz on the right. All of us are actually dentists. It's not just theory. We're like we're teaching you what we've done in our practices. Henry has an 18-op practice in Carolina, and Dr. Steve's got, 6 offices, like $20 million in revenue. Like, he has a big operation over there. So we are actual dentists doing that. And we're showing you the recipe. We're sharing our successes, our failures, our experience. That's what's going to make us different, is that the consultant can tell you what to do, but we've actually been there, and what to do and how to get it done are completely different things. That requires people skills, and it requires, a certain way of being systematic about presenting these things to your team. So Really quickly, I do have a 3-day freedom practice workshop. It's coming on February 19th. That is roughly about 6 weeks away. What I will do is I will go in detail on like creating a 6-month roadmap to get yourself to 3 clinical days or less. Remember, I said the first thing we do is get you to 3 days so that you have that extra day to work on your practice. We're going to teach you exactly how to do in detail the leadership structure, the roles. We'll give you all these things. It'll just be swipe documents. You could take these roles, you use them, you implement them with your team, and we create a way and a cadence of communicating and disseminating information within your team to keep you along this progress to getting yourself to a free practice. So we're going to show you just some few things. DPH block scheduling. This is a game changer. That'll change it. How we force capacity, because that's what's going to get us past that $2 million ceiling. The core leadership attributes. And this is, I think, one of the things I teach really well is leadership. And I was not a born leader. I learned it. And I learned it the hard way. I screwed it up a lot. But there are 6 core leadership things that I think are very easy to learn. And if you just follow these 6 principles and all you do, you will get motivation and buy-in from your team. You always do. We'll go through the 7 core dental office systems. We went through the 7 systems today, but we're going to show you what is the best practices for each of those. What to do with your CEO time. What do you do with your ownership time that you just found? And, the 4-day weekends. 4-day weekends rule. 3 days of work, 4-day weekends. Now you said, well, Paul, you said that 4th day you go and work on your practice. Yeah, you will at the beginning, but eventually you don't need to. And you just start taking 4-day weekends and eventually 5-day weekends. And I'm giving a 100% money back guarantee on this. So if you sign up for this thing and you're like, that sucked, just tell me it sucked. If you feel like it didn't get your value from it, I know it's going to deliver. I know this information is great. I've been working on it with dentists for 6 years. It's great stuff. If you don't feel like it's good, 100% risk-free, I'll give you your money back, okay? So if you don't feel like you got what you came for and you come to this virtual thing, you show up to it, you don't like it, I will give you your money back. All right, I do have, we had early bird pricing, that is gone, but I am opening another promo code. So this is the thing on your screen. You see it, dentalpracticeheroes.com/freedom. If you use the promo code Quick Action, you will get $500 off. That will be until Sunday night. Do not email me Monday and say, I totally forgot, I missed it. Can you still extend it to me? Because one of the things I believe in is integrity. And I think if I reopen that and go back on my word, that's kind of a crappy thing to do. I've got to be fair to everybody. So if you're going to sign up and you do want to come to that thing, please come use the Quick Action promo code. It'll give you $500 off. And if you're just interested in maybe one-on-one coaching, interested in our mastermind options, what else we have at Dental Practice Heroes? We've got a whole training library, 35 plus hours of training videos for your team. Book a strategy call with me. That's at dentalpracticeheroes.com/strategy. I'll get on the phone with you and we'll look at your practice and we'll say, hey, what's going on here? And give you I'll tell you what we offer and where I think I could help you. And at the very minimum, you'll just get some action steps to some things to work on. It's low pressure. I'm not going to pressure anybody to sign up for anything. I don't like working that way. So lastly, I told you I would give you this playbook. It is dentalpracticeheroes.com/playbook. That is where you get that document. So get it from there. So I will open up quickly for questions, but this actually took a little bit longer than I thought. I only got like 2 minutes. So if anyone's got a question, I throw it in the chat. I'm answering something from Jeanette. No, can't find this in the management administration board. Okay. All right. So I will make sure I get you that. Someone just couldn't get the file. I'll make sure in the follow-up exercise or the follow-up email that we will, if anyone has trouble downloading these files that I posted here, just shoot my assistant, just shoot a reply to one of the emails and we'll get it to you. But okay. So, man, everybody, thank you so much for being here. And I will send everybody a recording of this, so you can do this and print these things out and do these exercises. And like I said, that's 7 systems every quarter. But I thank you so much for coming to the webinar. I really appreciate it. And man, reach out to me. I love helping practice owners. And this is primarily my focus. Like I said, I only practice 1/2 day every 2 weeks. That either makes me the biggest, laziest POS, or I'm doing a lot of other things, which I am. I'm doing a lot of coaching with dentists. I wouldn't be able to sit on my butt that often. It's just not the way. And I don't think anyone could. I tried it. It didn't work. All right, guys. Thanks so much. Happy New Year. Have a great weekend. Thank you so much for coming.